welcome back to another YouTube video. Now in today's video I'm going to be taking you on my surgery rotation. Now to start with, surgery is a very broad department, which means that they have various subdivisions. Okay, so for this particular video I'm going to be taking you to my vascular surgery rotation. Okay, right now it's early in the morning, as you can see everywhere is still closed. So anyway, let's go.
But for renewal of blood circulation and suturing of bypass, necessary to have good blood circulation into periphery. Understand? And due to angio. Reversible changes, yes? Here into this moment, necrosis. Two hands, one hand to another hand. Yes. Arteria completa without circulation. Occlusion catheter, we think, because of acute appearance of pathology, acute onset of pathology, that it is thrombosis.
Now, what do we do when we get to school? We head to the change room, drop our bags, change into your lab coat because you don't really need your scrubs unless the doctor tells you that you're going in for an operation. After, you go to the department, find your teacher, and then your teacher will take you to see patients. Now, when you get here, your doctor will introduce you to patients. The doctor will ask you to take a case history or anamnesis. Now, here you're going to ask the patients questions like their name, their age, their occupation, their symptoms, when they started having these symptoms, how long they've been having these symptoms, when they got admitted into the hospital, if they've had any chronic disease or illness, and if there is a non-family illness as well, maybe like diabetes. Now, of course, just in case your Ukrainian language is not strong, the doctor or your teacher is going to be by your side, but usually they will not help you because they want you to have an interaction with the patient first, after which they can chip in, or if they see that things are not going right, they can now translate for you guys, and then after they will ask you what you believe the diagnosis, and then they will explain further. Now for this department, what we noticed is that most of them have the similar cause, okay, which had to do with their lifestyle choices. Most of them are chronic smokers and alcoholics, and of course these are part of the underground problems that lead to atherosclerosis and blockage of the different vessels, okay, which includes your artery and your veins, which is why they are in the vascular surgery department, okay, because this department have to do with vessels. Now guys, after seeing patients, whether or not your teacher tells you, always wash your hand and sanitize, okay? Usually each classes have sinks with soaps and running water there, so you can definitely make use of this. Now, for this week, I also tried something different. I made moi moi, but I didn't use beans. I used lentils. And lentils is a legume that, trust me, when you use it in place of beans, it's less stressful and it tastes exactly like moi moi. My housemates introduced me to it. And honestly, if they don't tell you that it's not made out of beans, you won't know. I can guarantee you this, okay? So if you want a detailed video on how I made it, this was actually my first time making it. But if you want a detailed video on how I made it, let me know and I'll definitely do that for you, okay? Just in case you don't know where to find powdered milk in Ukraine, I will have a video dropping soon where I will also show you where to get powdered milk. I have my peg for my milk, you know, the African way, to prevent air from entering into the milk and making it go bad. So guys, as the starosta/co-chef of my group, I had to go back to the gynecology department to get our credit book. So guys, I've gotten the credit book. So now I have to go to the deanery because I have something to do at the deanery, which is like this main building, the school main university. So I'm going to head there from here. It's going to take me like 7 minutes by walking. And after that, I will go and do some things with another teacher. So yeah, that's it. Let's go. So right here, our teacher was telling us about compression band materials, which are worn by patients or people who have problems with blood circulation, which of course is the problem that patients in this department have.
Maurice, on the upper part of the shin, lower part of the shin. 3 size is enough. We have compression 1, 2, 3 type. At that moment, next hand put on the foot, and after that, rupture, bend to the shin. At that moment, patient felt pain, calf muscle. Understand? Yes. First thing. YouTuber, let's go.
Yes, sir. I'll send it. Why are you walking like that?
It's cold. Why do I feel like Ella is videoing?
Oh, yes. Now, guys, with the many lentils from the moi moi, I made beans cake, okay, which is also known as akara. Now guys, when you're frying it, a little tip: don't fry it like you're frying beans cake with a lot of oil. No, fry it like you're making pancake, especially if you're using a frying pan like mine, which is not deep, okay? So you don't end up having a lot of oil, and you also bring out a very nice result just like this. So I ran out of custard, but my housemate had gari, so I took gari from her. So right now I'm having the lentils beans cake with gari and milk and sugar, and I hope you learned a thing or two from this video, and now I hope you have an idea how the vascular surgery rotation is. Bye guys, and see you in my next video.